Hello and welcome to USMLE Trainer's Clinical Vignette Made Easy review. My name is Dr. Patel. This will also be useful for Step 1 and Step 2 CK for the diagnosis and management question. We are going to go through a Step 3 clinical vignette and find the associated keywords. Time is significant, so let's go to the clinical vignette. 5-year-old female is brought to the emergency department with the complaint of crampy abdominal pain, diarrhea, vomiting since the last week. She has been feeling dizzy for 1 week and also complains of nausea immediately after intake of food and is sweating profusely. She has history of a hospitalization 1 month ago due to a bleeding peptic ulcer for which a partial gastrectomy was done. She has hypertension and diabetes since the past 5 years. Her medications include losartan, metformin, omeprazole, and antacids. On physical examination, she appears lethargic and ill. Her blood pressure is 100/70, heart rate is 112, breathing rate is 18 per minute, also called respiratory rate. Abdominal examination reveals a mildly distended abdomen and increased bowel sounds in all 4 quadrants. Which of the following is the best step in management of this patient? The following choices are as follows. A. Start a serotonin antagonist. B. Endoscopic evaluation. C. Start meals rich in carbohydrates. D. Start high protein diet. Or E. Start low protein diet. The correct answer is D. So let's figure out the diagnosis. This is classic dumping syndrome. The keywords found here in this clinical vignette to find the diagnosis are as follows. Partial gastrectomy, nausea immediately after food, which is called postprandial nausea, vomiting, crampy abdominal pain, dizziness, and sweating suggest the diagnosis of dumping syndrome. What happens in dumping syndrome is the food empties fast into the duodenum than normal, which leads to rapid gastric emptying. The food there is not properly digested into the stomach, and the small intestine cannot absorb the nutrients. The dizziness in dumping syndrome is due to hypoglycemia caused by the excess release of insulin in response to ingestion of high amounts of sugar. The treatment plan indicated for dumping syndrome is small frequent meals, a diet rich in high protein, low carbohydrate diet, and high fiber diet should also be given. The other choices were choice A, which was a serotonin antagonist. In this case, ondansetron, which is a 5-HT3 antagonist, which is effective for chemotherapy-induced vomiting and does not relieve the other symptoms. Choice B, endoscopic evaluation is not needed in this particular case. Choice C, meals rich in carbohydrates further worsen symptoms because in dumping syndrome, excessive movement of sugar in the small intestine raises the blood glucose level and causes the pancreas to increase the release of insulin, which causes a rapid drop in the blood glucose level, causing the symptoms of dizziness and profuse sweating. Low protein diet is not recommended in dumping syndrome. Our discussion today explains how to find keywords that led us to the diagnosis of dumping syndrome, which in turn led us to the management of dumping syndrome. Thank you for tuning in to USMLE Trainers Clinical Vignette Made Easy review for your USMLE preparation. USMLE Trainers preparation trains you to succeed. For more information about our services, please visit usmletrainers.com or contact us on the email or phone number provided. Thank you for attending and have a nice day.